Spring is in the air at Global Voice Broadcasting. Fresh new shows are hitting the airwaves every day. Shows about all the things that matter to you in your life. Music, fashion, celebs, and more. It's all here, and it's getting better every day. Only at Global Voice Broadcasting.
I highly recommend Ms. Hicks. Her books, her CDs are encouraging.
I bought her book, A Hill to Climb. She's a very inspirational speaker.
And I look forward to one day being able to work with her.
Your power lies within you. Let it loose.
Aspiration, inspiration, motivation, edification, determination. These are the keys of life success, brought to you by none other than award-winning author, motivational lecturer, business consultant, and much more, as she gets you aimed to your purpose. And now, ladies and gentlemen, young and elder, from Hollywood to the entire world, here is your host of Aim to Purpose, the radio show, Louise Hicks, along with her co-host, yours truly, Kenan Wesley Mason.
Hello, world. How is everybody today? And thank you all for joining us. As always, I am your host, Louise Hicks, along with my co-host.
Yes, I am Kenan Mason, and we want to welcome everyone listening in. Good morning, good afternoon, and good evening to everyone listening around the world. Global Voice Broadcasting, as we bring you Aim to Purpose, the radio show on this Memorial Day holiday.
And thank you again for joining us. And we have a great show for you today, because this show really does impact the world, particularly here in America. Since we are global, we are having a crisis in the area of mental health. And this is one of the reasons we wanted to bring you. In fact, this is a two-part show. And
Yes.
we have a guest here with us today that has a wealth of knowledge, Dr. Jeffrey Schaler,
Yes.
who will share so much information with us. And our topic today is the myth of mental illness. And Dr. Schaler is going to shed some light on why all these myths are here and how they occurred, why. And we're going to talk about psychiatry and the mental illness. And this show is really dear to me as well, because I have a son that has been diagnosed as mentally ill. And we are going to shed some light on that, because we are doing some things, and this has really propelled me into becoming an activist in this area. And we are going to jump right into the show, and we'd like to wish everybody a happy, joyous, and safe, of course,
Yes.
Memorial Day
weekend. Memorial Day holiday. This is the holiday where we, here in America, we celebrate the participating actions of our military veterans that have fought in combat or have gone into the military. This holiday here celebrates what they've done for the country. This particular episode here, the myths of mental illness, goes to what happens when the veterans come back from combat and they have nowhere to go, and they, I guess, have been almost betrayed by their own country. They go fight, and then they come back, and they have nothing to come back to. Spiritually, mentally, they have no work, and it wears on their way of looking at life after they've done so much for our country and beyond. So, and it also ties into our Go Mental campaign.
Yes, it does, because of the situation I've encountered with my son for the past 20 years, since he was diagnosed with cancer at the age of 14. And Dr. Schaler is going to talk about some of this behavior versus diseases. My son had a disease of cancer at the age of 14, and he went on to be diagnosed as paranoid schizophrenic. And which really propelled me into becoming an award-winning author because of our circumstance and situation, and with all of everything that has gone on for the past 20 years since his diagnosis has led me to the Go Mental campaign, where we will be launching a petition called Go Mental on change.org pretty soon, within the next week or two. And everything ties into what we are going to be discussing, because it is a severely, critically broken system. And as we are celebrating Memorial Day, as Kenan has just said, the vets are homeless, and they're broken as well as the system, along with my son. So without further ado, we're just going to jump right in and tell you a little bit about Dr. Jeffrey Schaler, and we're going to talk about the myths of mental illness.
Yes, Dr. Jeffrey A. Schaler, Ph.D., a psychologist in Maryland, has written extensively on addiction and social policy, as well as having taught thousands of undergraduate and graduate students about the myth of mental illness over the past 22 years at American University in Washington, D.C., Johns Hopkins University, and community colleges in Maryland, and Chestnut Hill College in Philadelphia. He is a well-known and popular international speaker, a close friend and colleague for many years of the late Professor Emeritus of Psychology, Thomas Sazas. I hope I'm pronouncing that correct.
It's a tough one. Saz.
Right, Saz. I got it. Professor Schaler is currently working on his 6th and 7th books, both focused on why behavior can never be a disease. His book, entitled Addiction is a Choice, was the centerpiece of a John Stossel ABC News 2020 special, and his book entitled Peter Singer Under, The Moral Iconoclast Faces His Critics, won the American Library Association Book of the Year in Philosophy in 2010. So, and we are happy to have him here. A warm, aimed at purpose, the radio show welcome to Dr. Jeffrey A. Schaler.
Hello, Dr. Schaler, and thank you so much for joining us and accepting this heartfelt invitation to come on our show today so that we can dispel the myths of mental illness. Welcome.
It's very kind of you to invite me. Louise and Kenan, it's very kind of you to have me here, and I'm happy to address as many issues as we can. As you know, it's a very controversial topic for many people, and so how I'd like to begin is to just talk about some of the differences between what we call a real disease and what a behavior is. Because when people say, what do you mean there's no such thing, or there's a myth of mental illness, I'm not denying that people act in distressing, disturbing, often irrational ways. That's not the issue at all. And those are very, very upsetting, particularly for family members. But what we have to abide by is what is a disease and what is a behavior, because the consequences are serious when we define a behavior as a disease. For example, if we say that a behavior is a disease, we excuse responsibility for that person's behavior, and that has serious consequences for the law. If that's where you see the insanity defense come into play. And if somebody does not want some kind of psychiatric help, and psychiatrists pronounce their behavior as a disease, they're often coerced into a psychiatric facility and coerced into taking drugs that they don't want to take. Now, I'm all for what we refer to as contractual or consensual psychiatry and psychology. If somebody wants help, by all means, they should go to the source that they find most rewarding. But one of my biggest concerns is forcing people who don't want a particular approach. That's what concerns me. So if we look at, you mentioned, and I was very sorry to hear this about your son's diagnosis of cancer. Cancer is, of course, a real disease. And one of the ways that we identify a real disease is we look at what are called cellular abnormalities. These are identifiable under a microscope. And we also can find diseases in a cadaver during an autopsy. But we cannot find a behavior. It doesn't make sense in a cadaver in an autopsy. So when we say that schizophrenia or post-traumatic stress disorder or depression all refer to bizarre behaviors, obviously we can't find those in an autopsy. These are things that people choose to do for reasons that are important to them. It doesn't mean that we understand them. You know, when you talk about soldiers coming back, post-traumatic stress disorder, in fact, is nothing new. For centuries, people have been diagnosed with shell shock, battle fatigue. During the Civil War, I believe it was called soldier's sickness. And people were, if you looked at it from an existential point of view, they were horrified at what they went through. The stress, seeing their friends killed, killing people, that just drove them crazy. And again, that wasn't a disease, but it made it very difficult for them to function and adapt when they returned to regular life. It's not an unusual experience, and I think it's something that does require help when people want it. And there should be some help available. I tend to look more towards the private sector because I get concerned about what government is up to. They're too easily lobbied and influenced by people who want help to go a particular way and not another way. So I think our churches, synagogues, religious groups, and secular groups can do a much better job helping people who want help than government can.
And I agree so much with you, Dr. Schaler, because what you're saying has so much merit to it. When you think about the different, what you just defined for us really is the difference between what has been deemed mental illness versus a disease. As you've stated, a disease is something you can find, and it is something that is not invented, because behaviors is what, and correct me if I'm summarizing this wrong, the behavior is not a disease. It's something that's invented, and whereas a disease is something you can really discover and identify because it is real. Like when my son was diagnosed with cancer, that is a disease. Now, from the cancer, he was only 14, which led to depression and drug addiction, and I think a lot of it has to do with him never being detoxed from all of the highly addictive drugs that he was given when he was going through the chemotherapy and so forth at the age of 14, and being so young and unable to emotionally, spiritually understand what was happening to him. And I'm not being aware myself as I am now, with still my limited knowledge, how to be able to help him. In the medical field, it appears that I read in a newsletter from the Citizens Commission on Human Rights, which is how I found you, and I'm really happy about that because I became a member of the Citizens Commission on Human Rights, and I wasn't aware of it until my son Kenan here shared that information with me, and that helped me from going to the museum better understanding what mental illness is, and which caused me to launch this program. And what you said, the campaign we're launching, Go Mental, and what you said about the private sector versus the government, I have found along my path that is so real. It's really true, because the government seems to have their own agenda, and it's all about the profit and power. And why do you think, since psychiatry started, I guess, back in the 17 or 1800s with Dr. I think his name was Rush, Dr. Benjamin Rush. And why do you think it has become so powerful, and why so many psychiatrists now are jumping on this bandwagon to keep people in the dark about mental illness, because a lot of people are not aware of it?
Well, I think that it gives psychiatrists and others something to do with what is considered society's unwanted. And one of the places you can see this is where people are labeled as mentally ill. They're called the homeless mentally ill. Although many of the people who are diagnosed as homeless mentally ill aren't, quote, mentally ill. They're stricken with poverty. Mm-hmm. They have all kinds of problems that puts them out on the street. That doesn't necessarily mean that they're sick. So, we have to be careful who we classify as mentally ill. Now, another place where you see psychiatry playing into social control as opposed to the treatment of illness. And many real doctors won't engage in this. Once I talked to a friend of mine who's a physician, and I said, how come you didn't go into psychiatry? And he said, because I saw what they did to people, and I didn't want anything to do with it. Mm-hmm. You always have to give your consent for treatment.
Right.
Right now, as an adult, now I'm differentiating between adults and kids, but as adults, even if you have cancer, they ask you for your consent. You can't be treated without your consent.
Right.
But when it comes to mental illness, people can be forced to take medications that often have terrible, terrible side effects. Mm-hmm. One of the ones is a drug that inhibits a neurotransmitter called dopamine. And when that dopamine is inhibited, over the years, it creates a condition that's known as tardive dyskinesia, and that is very similar to Parkinson's disease. With Parkinson's disease, the brain does not produce, which is a real disease, does not produce enough dopamine, and if you give a drug to control somebody's behavior that inhibits dopamine, they develop the symptoms of Parkinson's called tardive dyskinesia. Right. There's one area where you can see this prevalent, and that's with our senior citizens. At centers for senior citizens where they develop a condition called sundowners syndrome, where at about 5 o'clock, when they're struggling with some form of dementia, they start to leave the home that they're in and wander out. And you ask them, where are you going? And they say, I'm going home. And they say, and the help there says, but you are home, even when they're at their own home or at a facility where the family has to keep them because they can't care for them. They think that they're someplace other than where they live, and they cannot staff enough people to take care of these individuals. And you hear about them on the radio all the time. An elderly gentleman is lost in very cold weather out in the woods in some part of the city. He's left. They don't know where he is. And unfortunately, they find him dead because he can't find his way home. Well, what many psychiatrists do is prescribe these same drugs that are used for psychosis because it keeps them put. It keeps them from leaving the home.
Yes.
And the American Psychiatric Association has issued warnings to psychiatrists for many years saying, stop prescribing these drugs because you're worsening their Parkinson's disease, you're worsening their Alzheimer's, and you're making it as if it's some kind of medicine when it's really just a form of social control. See, that's an example of something that's being done in the name of practicing medicine that doesn't really have anything to do with medicine. They aren't curing the disease of Alzheimer's or curing Parkinson's disease or anything like that. They're just making them sit still because they don't have the staff to help these individuals. And that's, if there's any government money that needs to go to help individuals like this, that's where it needs to go, to provide for our elderly, for children, and for people who are really sick.
Absolutely. I wholeheartedly agree with what you're saying. In fact, I know firsthand what you're saying. Not only do I have my son, who's now 34, that I've been dealing with for the past 20 years, who has been now labeled paranoid schizophrenic. I have a 91-year-old mother who has been drugged due to her various medical conditions that she has, and we had a doctor to come over, a medical doctor, to assess some of these drugs that she was being given, and many of them were for the same thing. And the medical doctor, fortunately, wasn't one of these doctors who was just a drug pusher, with all due respect to the medical profession. But this doctor said himself, why is she taking all these drugs? She doesn't need this. She doesn't need this. Right off the bat, here he was eliminating all these different drugs. And I've done a lot of research myself over the years, and it appears to me that it's all about power and profit and greed, and greed for that matter. And until we take that out of the equation, this will continue, and it has to go back to the education as well. Now, something you touched on, Dr. Schaler, that I'd like to hear you elaborate on some more when you talked about the poverty and the throwaway, that's what I call it, the throwaway of these this population in our society, because they don't want to spend the money. They'd rather give the money to the high-powered CEOs that are screwing up all the money out here with the banks and other corporations and their lobbyists who are going in, making it work for them. But in these crossroads of this catch-22 situation, where parents like myself, and I know there are a lot out there who need help, and we aren't getting the help because you're saying whether the person wants to take drugs or not. Now, at some point in time, because of all these psychotropic drugs, like my son has become, he's incapable of now making decisions for himself because he thinks he's okay. My son really thinks he's God now, and he was found lying in the middle of the streets because he feels no one can touch him and nothing can touch him because of the drugging of him and the population out here. So how do we address this issue with people like that in the population that aren't capable of decision, but still they shouldn't be just strapped down and drugged, because that's inhumane, and that's what's happening to many of them. So how do you address that?
I think one of the ways is programs such as yours, where people can talk about these things, and voices, the minority voice in terms of what psychiatric policy is all about, needs to be heard, and it's too often suppressed. For example, many people think that antidepressant drugs are wonderful. It's amazing how many people take them. And I'll give you an example I use in my book, Addiction is a Choice. Imagine a woman who is married, and I'm just saying this as a woman, it could be a man, it could be anybody, and she's very, very unhappy in her marriage. What she needs to do is go back to school, get a job. Perhaps she needs to separate from her husband or go into couples counseling or whatever it is. But she doesn't do any of this. She just makes her husband the center of her life. She has no life of her own and provides for him at home and is a good wifey poo, as her husband might describe her. And then she goes to her gynecologist for a regular checkup, and the doctor there, her doctor, notices that she looks very depressed. And she says, "How do you feel?" And she gets this out of her that she really is very unhappy. She breaks down and starts crying. And the doctor says, "How about if you try a drug like Zoloft or Prozac or one of these drugs?" And let's assume, and it doesn't work all the time, but let's assume she takes this drug and she feels better. Now, most people would say, well, what's wrong with that? What I'll tell you what I think is wrong with that, and that is that where is her motivation to make the changes that she needs to make in her life? Because now she feels good in a bad situation. If you say to her, "Did you go to school? Did you get a job? Did you confront your husband? Did you work on any of these?" "I don't need to. I feel good now." She feels good in a bad situation. That scares me a lot, because the incentive and the motivation to make the changes that she needs to make are no longer there.
Yeah.
And that,
no, go ahead.
Just think of that. It's terrible. It can be a terrible situation. I mean, people who are imprisoned are happy being imprisoned because they don't need to do anything different. I have young, well, he's not that young anymore. He's 28 years old. He smokes pot every day. And I think that there's a lot to be said about repealing drug prohibition because I think it causes more harm than good. But he smokes pot every day. And I'm getting to the point now where he's starting to see, and boy, it is a hard thing to get him to see, that he is not doing the things he needs to do to provide for himself. Get a job, do what's necessary to get a job, because he's perfectly fine being high on pot every day.
Right.
He just sits, spaces out, plays video games, and does nothing. Instead of develops a trade, something that he can do, that he can sell as a service, a marketable skill, he has no more motivation. That's the same kind of effect that anti-drug medication can have too. Although many psychiatrists and psychologists say, well, you give this drug and it gives them a foot up. It helps them to do what they need to do. But if you look back on your own life, and I ask everybody to do this, don't you think that every major change that has been for the good in your life has been based on some experience of discomfort?
Yeah.
Yes.
That discomfort motivated you to do what was necessary, even if you had to leave your husband. Of course, that's hard. It's a terrible, terribly difficult thing. But you may recognize that it was necessary in order for your own happiness.
Right.
These are the types of things that we shouldn't just drug away. We need to look at the experience of pain and see why the pain is there and change our lives accordingly, not just make ourselves numb to it. I'll let you respond.
Yeah, it's almost like we don't want to recognize our hardships or be aware of our emotional faculties. What these drugs do is it shuts off our emotional factors. We become physical zombies. We become trapped in our own we become trapped in our own emotional hang-ups, and and the notion is that the drug will take it away versus our own inner intellect that we all have. We suppress that side of us by thinking that a drug will brush things under the rug, or it will make everything go away all of a sudden.
Right.
And we see this because it's embedded in our subconscious every day through the advertising, because during the commercials that you see on television, they run off the side effects, the so-called side effects, but they, at the same token, they show people running through the fields, happy, jumping for joy in slow motion.
Right.
So it's a play on people's emotions during advertising, because the people that create the commercials and the advertising, I don't fault them. They're marketing geniuses because obviously it's working.
Right.
Yeah, it is
right.
working. It's working tremendously, and I like that analogy you gave about the wifey who's sitting at home and she's unhappy, but the drug is the fix-all, and that's what we have become an American medicine cabinet, really, because drugs, and it's all by design from my perspective, and that analogy you gave was so exact, and it's a reality because people aren't facing the reality of their own purpose in life. Why are we here? Are we here to be drugged to death? Because that's what we are becoming, a society of druggies. And we'll all be drug addicts if we continue to listen to what some psychiatrists say. Because I share with you, Dr. Schaler, what a psychiatrist told me. My son was detained by the police. I won't say arrested, because they know us in the community, and because of the work I'm doing now with me writing to the president on down over the last 2 months, because my son has gotten progressively worse. And I'm speaking to a hospital, a county facility, and you're right when you say government. This is a county hospital,
Right.
and I worked for the county for 32 years in management, and I retired almost 10 years ago, and I'm happy that I did because now I can be on this mission. But the psychiatrist told me when I asked him, could he do something and help me to get my son the help he needs, which is healing of his body through mind, body, and spirit, and not just to give him drugs and put him back on the streets. He says, well, if he, and this is at Harbor UCLA Medical Center in Torrance, California here. And the psychiatrist says to me, well, and I'm paraphrasing, if he's capable of survival out on the streets for 15 years, because my son has been in and out of jail, shelters, the parks, and I've done everything I can possibly do within the laws because he is an adult to get him the help he needs. And he says, he's capable of making a plan of care, and we'll hold him and send him over to this urgent care. And if they feel he can make a plan of care for himself, they're going to discharge him. And that's what has been happening, which prompted me to start this Go Mental campaign to get to Washington, D.C., to talk to these policymakers, because obviously they don't care about the homeless, including the vets who go out and work hard. And here we are celebrating Memorial Day, and these vets are on the streets homeless without a place to live, and these legislators are sitting here, they could care less.
After serving the United States of America, mind you. and they're on the streets really homeless.
You know, what you're saying is so true. We live in a drug culture.
Yes.
Look how many people are on drugs. They're either being prescribed drugs for their mood or for physical problems. They're either using illegal drugs, or they're using over-the-counter drugs. A lot of people take far too much Tylenol and Advil and drugs for aches and pains that can have long-term effects that they think aren't going to be there. You know, you mentioned the word zombie. I really am tuned into that because I think, why are there so many zombie movies on television?
Right.
It's almost like, I always think these are social commentaries that people have become like zombies. Obviously, they're not dead people walking, but what the message is that they're not really thinking anymore.
Yeah.
You know, so moved by that woman who, in the riots in Baltimore, got up and whacked her son right off of the street like that.
We talked about that on the show.
Did you? Well, I mean, if she was on an antidepressant because she was upset about her son, do you think that she would have been motivated to get out there and do something? I doubt it. But I bet she thinks she wasn't on an antidepressant drug. What she did was got up off her butt and went out there and grabbed him and hit him right home. I admired her great deal. I'm not advocating violence, but there's some times when a mother needs to go ahead and do something like that instead of just going, woe is me, this is terrible.
Yes.
And then feeling okay because you're on some kind of drug. And you, Louise, you're doing something. It's the doing something that I think is so important. It's an action that needs to occur and not just be passively taking drugs or following the directions of medical authorities. We give up so much of our autonomy and independence.
We give
and
up
just bow down.
That's right.
Yeah.
We bow to the authority that puts the pharmaceutical drug on our consciousness every single minute of the day and night, if you will. Now, we're talking about myths of mental illness, and you mentioned the over-the-counter drugs as well. First question, can statistically, are more people using legal prescription or over-the-counter drugs over what we have the so-called war on drugs, all the illegal drugs? What's the ratio for that?
I know that there are more deaths associated with prescription drugs than illegal drugs.
Okay.
That
say
people
that again,
Yes,
Dr.
yes,
Schaler.
yes.
Excuse me. Please say that again, because people
There
don't
are-
realize that. So please repeat that.
It's in the papers pretty regularly. There are
Yes.
more deaths associated with prescription drugs than there are drugs on the street, illegal
Yes.
drugs.
Yeah.
Sure, there are people who overdose on heroin or cocaine, but not nearly as many as people die from prescription drugs.
Thank you.
That's a big one. That's a big one for people to pay attention to. Are people using more drugs for aches and pains? They certainly are.
Right.
And I don't know if you've talked about this before, but one of the big reasons people go to doctors today is for back pain. And I can speak from experience because I had major back surgery about 11 years ago, and my life has been essentially ruined. I've become what's called a chronic pain patient. I can only walk 20, 25 feet before I have to stop and rest. The pain is just horrible. And they want to give me antidepressant drugs. And I say to the doctor, I don't need an antidepressant drug. I need a drug to stop the pain. And actually, those drugs, I think, after studying this for many years, when taken the way they're prescribed, opioid drugs are actually safer than many of these antidepressant drugs. I say to them, I'm depressed because I'm in pain. If you get the pain away, then I don't feel depressed.
Right.
They have a very difficult time understanding that. They want to bombard you not only with opioid drugs, but with antidepressant drugs too. And I think feeling down, and I'm sure that your son at some point, recognizing that he had cancer, just as you did, felt very depressed about the whole thing. Depression, a friend of mine once said to me, if you read the headlines in the paper every day and you aren't paranoid, there's something wrong with you.
Right.
That is so true.
Right.
Absolutely.
There's a lot of stuff that's awful in the world, and feeling lousy is an appropriate response. I mean, I don't understand. The drug manufacturers and many psychiatrists think the right way to be is to run around clicking your heels in the air and feeling, happy all the time. Life is hard.
I've always believed, as after the last 13 years of being in the health and wellness field, most, or if not all, of your psychotropic drugs are created to shut down any and every emotion that we could possibly have. And we know this because of the Diagnostic and Statistical Manual, which has grown. It's like a Bible now.
Exactly.
Yes,
right.
it is. And what we're going to do, we want to talk about that, and we want you to talk about, definitely this DSM manual. And we're going to have to take a break, but when we come back, we want to talk about the DSM, and we also want you to shed some light, Dr. Schaler, on continuing with the myth of the scientific aspect of mental illness, and what talk about blood tests. Can they do anything, and how our brain lesions tied into the psychiatrists saying that that mental illness is a disease. But we're going to take a break, and then we're going to come back and talk about that.
Yes,
Well,
we'll be
thank
right
you.
back.
I'm happy to do that. You have a wonderful show. Wonderful show.
Thank
Thanks.
you. And we will be right back. Don't you go nowhere. This edition of Aim to Purpose, the radio show, is brought to you by L. Hicks Consulting Services. When you want the best in business coaching, life coaching, or perhaps your organization, business, or company is in need of a dynamic speaker for an upcoming workshop or seminar, contact Louise Hicks for L. Hicks Consulting Services at 1-562-310-1495. From anywhere around the world, that's 1-562-310-1495. For more information about Louise Hicks and her consulting services, visit her website at www.louisehicks.biz. Again, that's www.louisehicks.biz. Or call 1-562-310-1495. L. Hicks Consulting Services, where professionalism is top priority.
host of Aim to Purpose, the radio show, along with my co-host, Ken and Wesley Mason. And we have a great show here this Memorial Day. We're talking to Dr. Jeffrey Schaler, who is dispelling the myths of mental illness. And we need this type of education because many of us really don't understand mental illness. And the ones of us who do, we are really starting an action, a call to action, because we need it. And when we left off, we were talking about the scientific aspect. We want Dr. Schaler to talk a little bit more about that. Is it a true science, actually? And about this DSM, the diagnostic
and statistical manual
for mental disorders came about because of psychiatrists. And as I've mentioned, and I have no problem saying this, from what I've seen from my own firsthand experience with my son, it's all about the profits. And me speaking with psychiatrists, and many of them that have dealt with my son don't want to speak with me because of I share my sentiments of what I think and what I feel about this industry and how it has become so powerful, and we need to really look into it and get some policy changes as a result of it. All of us can be walking around like zombies here.
Right.
So, Dr. Schaler, let's talk about this DSM and how did it come about, and also tell us about the test. Is there any test that can prove a person is mentally ill based on scientific knowledge?
Well, you've asked some very important questions, and I'll answer the last one first, and that is there is no test that can identify any alleged mental illness. Now, one of the ways that people have been searching for alleged causes of mental illnesses that are listed in the DSM, and all your listeners should know that the DSM does not explain why people act the way they do. All it does is describes how people act in terms of their anxiety, depression, problems with other people. Those are called personality disorders, and then thought disorders, what are called schizophrenias, etc. And no
root cause.
No what?
No root cause.
Right. There's no root cause. Exactly. Mm-hmm. And you should, in terms of, Louise, you mentioned about inventing disorders. The best example of that was how homosexuality was included as a mental disorder for years, until 1973, when the American Psychiatric Association declassified homosexuality as a mental illness from the DSM. Now, what that tells me, and I think listeners should look at this, is that it was included for political reasons and it was removed for political reasons. Right. It was never included because people discovered a gene or some brain difference or some blood level difference in people that were homosexual, and it wasn't removed because they decided that they were wrong.
Right.
It was a political process, and that's not true for real diseases. We may not see any examples or cases of smallpox anymore, but that doesn't mean that smallpox ceased to become a disease. We succeeded in controlling it. And like, say, in West Africa, Ebola, if we eliminated all the cases of Ebola, that doesn't mean that Ebola isn't a disease. It's just we've succeeded in controlling it. Right. Now, one of the things that people talk about in terms of the DSM is they liken it to something called the hammer of witches, which was originally called the Malleus Maleficorum. And during the middle century, people who were social undesirables were diagnosed as witches. And there were several ways in which this was done. There were marks on the person's body that witch detectors who were connected with the church had. One of them was that the person had a third nipple, which was a common birth defect. The person had some peculiar mole or dark spot. They had a particular odor on their body. They walked out and acted odd during a full moon, whatever. And when they were said to have made a pact with the devil, they were then called a witch. That's what it meant to be a witch. The person had made a pact with the devil. And one of the clearest signs of being a witch was to deny that you had made a pact with the devil, and even worse, that the devil even existed. That confirmed that the person had made a pact with the devil. And the treatments were not very pretty. For example, for women, they did clitoroidectomies without any obvious painkillers. Some women, mostly women, but there were men who were considered witches, were thrown into a body of water. And if they floated, that meant they were a witch. And if they sank, that meant they weren't a witch. And theoretically, somebody would dive in the water and get them if they sank. But the witch detectors said it doesn't matter whether the person drowned because he wasn't a witch. And what's important is that his soul is protected and he will go to heaven and be with God. So it doesn't matter whether we rescue him or not. Mm-hmm. I mean, these were the kinds of rules that persisted, and they were all collected as signs or indications in the Hammer of Witches, the book that was used. And some people, sociologists, have likened the contemporary Hammer of Witches to the DSM. In other words, these are the indications. Now, from a scientific point of view, here's one way to look at it. For something to be truly scientifically based, there must be reliability and validity. And imagine we're all in a room together and I bring in a person who I say is a witch, and we have all these criteria that indicates that she is a witch, and everybody in the room says, yes, she smells a particular way, she has marks on her body, she has a third nipple, she is definitely a witch. But does that mean that the devil exists and that this person made a contract with the devil?
Right.
No. Now, you can have the same thing in the DSM. The DSM has gone through lots and lots of criticism over the recent years because there's been so much difference of opinion. I'll give you a perfect example. I was teaching at a university, and the head of the chairman of the psych department said, Jeff, help me settle an argument. Do you think that schizophrenia belongs under, or no, it was, what do you call it? A multiple personality disorder. Do you think multiple personality disorder belongs under the schizophrenia category or under an anxiety-based category? And I said, well, strictly speaking, if you follow the rules for categorization, it would belong under anxiety disorder because the person is so anxious about what's happened to her being Sally that she now calls herself Francis, whatever. Mm-hmm. So he said, no, that's wrong. It's got to be under the schizophrenia. But the point is that there's a difference of opinion among practitioners. And if you brought a patient in and some doctors said he's got diphtheria and others said, no, it's diabetes, you would say somebody's got something wrong here. Right. You know, there's got to be a consistency of diagnosis. And that's something we call reliability. And in psychiatry, it's very, very low. There's too much disagreement about what people have in terms of their mental illness. But even if there was agreement, because what's happened now is that the psychiatrists and the authors of the DSM, and let me mention this too, the editor-in-chief of the DSM, a psychiatrist by the name of Alan Francis, who I debated online at the Cato Institute in Washington, publicly said that the DSM was BS. And I'm being polite here. He said this publicly. It was BS. And that's a heavy statement for the editor-in-chief for years. He said, these are not diseases. Now, what does that say to us when the editor-in-chief comes out with a statement like that? It's rather remarkable. But now, to get back to your point about the science, what people are doing is trying to look at the brains of people who are diagnosed as schizophrenic and those who are considered normal. And the theory is that somebody that we say is schizophrenic has different brain structures and functions, as evidenced by MRIs or PET scans or CAT scans, and that these brains are different in people diagnosed as schizophrenia than people who are considered normal. Now, for that to be a legitimate way of ascertaining that schizophrenia really is a brain disease, you would have to have 95% of the people who are called schizophrenic have to have those brain differences. And the people who are normal cannot have those brain differences. Right? But now what we know for a fact is that there are people who are normal who have the brain differences, and there are people who are called schizophrenic who don't have the brain differences. That basis alone means that we don't really have a means for diagnosing brain diseases. In other words, you couldn't take a person you think is schizophrenic and have a picture of his brain structure and function taken and then find out, yes, he is schizophrenic, as evidenced by this picture. We just can't do that.
You can't see schizophrenia under a microscope. You can't see depression under a microscope.
That's exactly right, Kevin. Exactly right.
You can't see these things. They want to treat a non-physical something non-physical or a non-physical illness, if you will, with something physical, as in your synthetic chemical drugs.
Exactly. You've got your finger right on it. And I'll just say one more thing, because this always got my students all up in arms. But many of them came around to saying, this doesn't mean that what Dr. Schaler is saying is insulting. It's just something we need to think about. When people are diagnosed with schizophrenia, the main way that they are diagnosed is through their exhibition of hallucinations. And hallucinations are self-reported imaginings.
Yes.
For example, if I say, Louise, there are pink elephants walking upside down on the ceiling in my office here. And then I said that there are zombies walking around in my yard. A psychiatrist would say, Schaler is hallucinating. And this is a symptom, it's not a sign, a symptom of schizophrenia. Now, what I want to point out is that we have socially acceptable and socially unacceptable hallucinations. For example, over 70% of people in the United States believe in angels. They believe that angels watch over them. And so many people talk about how Jesus has entered into their hearts.
Right.
Now, I'm not putting that down, but what I'm saying is that those are self-reported imaginings. Mm-hmm. They're just socially acceptable ones.
That's right.
You see?
That's right.
Absolutely.
And what happens if you press psychiatrists and say, well, what about all these people who believe in God and believe in salvation? Aren't you going to give them the drugs?
Right.
And
they're the crazy ones
hear them
too.
saying, right. That's right. And psychiatrists are not going to go there because they know what's going to happen to them.
They sure do know what will happen to them. So they will not go there. And we have about, I guess, 6 or 7 minutes left. And I want to touch on a couple of other things. The blood test. I mean, we already dispelled the myth on the scientific aspect, the disease aspect. Now, what about blood tests? Can we go and get a blood test if I'm to determine that I'm mentally ill?
Absolutely not.
Right.
There is nothing that you can do.
As simple as that.
It is as simple as that, but you can get a blood test to see if you have anemia, iron poor blood, or you're lacking in all kinds, or you have an infection, high white blood cell counts, or platelets are too low, and your blood doesn't coagulate, you bleed too easily. All of that stuff can be ascertained through blood tests. And frankly, I think we need more tests when we go to see a doctor so that we can know objectively what's going on. But that cannot be done with the diagnosis of mental illness. End of story.
And,
Right.
it makes so much sense, too. And something else you touched on, Dr. Schaler, you talked about the private sector and the government versus and putting this perhaps in the private sector. And you mentioned something that kind of struck a chord with me when you said religion, maybe go there. And that strikes a concern with me, and I'm going to tell you why. Because of the greed in religion and politics are really, from my perspective, two of the most divisive establishments in the country. And religion over the years that we have seen, it has expanded so much into greed and profit.
They're bedfellows.
It really frightens me to put. I would not put my son in the hands of a religious organization at this point in time. And the reason being is from all of the extortion, for lack of a better word I can say right now, that comes with religion and politics.
I agree with you, Louise. What I meant is that some private sector needs to take charge. People who care, who don't stand to benefit other than to do good for others. You know, that's what we need. And you're right. I get very concerned about people who are forced into Alcoholics Anonymous, because many times in Alcoholics Anonymous, people are just beaten over the head to say, you have a disease, you have a disease, you've got to say you have a disease.
Yes.
And the person says, I drink because I've got problems in my life, but I don't want to say that I have a disease.
Right.
And, you know, in that group, and in addiction, which we haven't touched on, but, you know, many people say that addiction is a disease. Well, if it was really a disease like cancer, how could they quit?
Right.
You're so right.
You can't quit.
You wouldn't be able to quit if it was a disease. How can you quit?
Right.
Exactly. And the only way that people can stop using drugs is by making a decision to do it.
Absolutely.
Right.
Taking control of your own life and deciding I have a positive purpose in life and I'm going to live my life positively, as opposed to, and like I said, I believe that these things are by design because it keeps the poor, and you really touched on it. And I'm glad this is a two-parter because we really need to get more into it, and we're going to get much more into it when we go to our show with you on, I believe it's June 1st, that Monday.
That's right.
Part
at,
2,
Part 2, 5 p.m., where we're going to talk more about the psychotropic drugs at that time. We're going to talk about more about the laws in America and the addiction aspect of it, and how physical fitness play into mental illness as well, because there are fitness experts who don't even realize this. I think they think you just fit and it has nothing to do with mental illness, but it's so many things that play into this, and this behavior aspect that you have so uniquely defined what the myths are, and it shows your expertise in this area. You've been in this field for a long time, and your knowledge is just you have a wealth of it.
Yes, and
it's
one
a real
more
pleasure.
One more myth in the couple of minutes that we have left, because you mentioned how you have back pain and things like that, and you mentioned Tylenol again, because people go to this and other over-the-counters for headaches or migraines and things of this nature, but we've come to find that the base of these over-the-counter drugs like acetaminophen and things like this are really damaging, can be damaging physically to the liver and other organs and the brain as well. Can you kind of really quick, in a nutshell, kind of dispel that myth? Because when people get the slightest headache, they run to their Rite Aid or Walgreens for their OTC drugs.
Well, we know for a fact that when people take Tylenol and drink too much, and I say this to my college students, you drink too much, and then before you go to bed, you take a bunch of Tylenol to avoid the hangover.
Right.
You put your liver at terrible risk. There are people that have had complete liver damage from that type of mixing of alcohol and Tylenol, especially. If you want to try to reduce having a hangover, drink lots of water.
Mm-hmm.
Your body is dehydrated from all of the alcohol. And of course, take a look at why the heck you're drinking so much. You know, is it worth the price that you're paying?
Yes.
What happens when you drink is that you're numbing yourself to real problems that you're not solving in your life. And that's ultimately what you've got to do in order to reduce your headache, whether it's a physical headache or a psychological headache.
Yes. And in part two, I want to definitely expand on that part of it, if you will, because the brain is made of water really quick, and we need water to create electric current in the brain. That's how it functions.
Right.
So I definitely want to thank you, Dr. Schaler, for being our guest on Aim to Purpose, the radio show. We will have you back next week at this same time, and for some more knowledge and information, because information is power. And with that being said,
thank you. It's been a real honor. It's been a real honor and a pleasure to be with you on your show. Thank you so much.
Thank you so much.
Thank you, and we will talk again next week and expand on this very important topic, because we know that the mental health system is broken, critically and severely broken here in America. And until next week, be sure and join us on Twitter at Aim to Purpose, on Instagram at Aim to Purpose, Facebook at Louise Hicks 51, YouTube Aim to Purpose Radio. We have a blog, so go to louisehicks.biz, and you can link to all of our social medias.
And call in from anywhere around the world really quick, 1-323-522-5482. Call in next week if you have any questions or comments. We would love to hear from you, because this is a global phenomenon, and we're going to be one of those shows to go in head first and tackle it. So, so next week we will have Dr. Schaler back. So on that note,
remember, your power lies within you. Let it loose, and have a safe Memorial Day holiday.
Till next week.
Exactly. Thank you so much. Thank you.